the bright and morning stars, with the power to be seen across the world. We're not the future, we're the present. Invest in us and you will see the world is changing.
Because our bodies and the future we hold it. We want for you to see that everybody can win. Could it be education or contraception? Everyone will always be here to sing.
We are family and we are planning to go around the world telling everyone that we demand a voice. We are family and we are planning to go around the world telling everyone that we demand a choice. We on the ground in every area. We're the ones to make a world a better place. We want the best, we want the way. There is something for a future so bright.
Because our bodies, and the future we holding. We want for you to see that everybody can win. Could it be education or contraception? Cause the boys we always be fine.
We are family and we are planning to go around the world telling everyone that we demand a voice. We are family and we are planning to go around the world telling everyone that we demand a choice.
We gon' climb up and then rise up. Won't keep our eyes shut, we ain't got enough. I know you tired of seeing things the same way, but in time you realize that things change. We the demographic dividend. You see the work that we putting in. I'ma stay true to me and use my opportunity to show you how to build a community with unity.
உன் வாழ்வு உந்தன் கையில், எதிர்காலம் உன் கண் முன்னில். மனதையும் உடலையும் பாதுகாப்பாய். வேண்டும் வேண்டாம் என்று சொல்ல உனக்கு மட்டும் உரிமை உண்டு. தேவையில்லா குழப்பம் நீக்க வெவ்வேறு பல வழிகளும் உண்டு. உதவக்கரங்கள் உண்டு, முன் வந்து சொல்வாய் இன்று. உதவக்கரங்கள் உண்டு, நீ முன் வந்து சொல்வாய் இன்று. இன்றே முடிவு செய், உடல் நலத்தை உயர்த்தி வை. இன்றே முடிவு செய், உடல் நலத்தை நீயும் உயர்த்தி வை.
Because our bodies, and the future we hold. We want for you to see that everybody can win. Could it be education or contraception? Girls and boys will always be fine. We are family and we are planning to go around the world telling everyone that we demand a voice. We are family and we are planning to go around the world telling everyone that we demand a choice. We are family and we are planning to go around the world telling everyone that we demand a voice. We are family and we are planning to go around the world telling everyone that we demand a choice. We are family Hey, no.
Got you, bitch.
We are the stars, the bright and morning stars, with the power to be seen across the world. We're not the future, we're the present. Invest in us and you will see the world is changing.
Because our bodies, and the future we hold it. We want for you to see that everybody can win. Could it be education or contraception? Everyone will always be here to sing.
We are family and we are planning to go around the world telling everyone that we demand a voice. We are family and we are planning to go around the world telling everyone that we demand a choice. We on the ground in every area. We're the ones to make a world a better place. We want the best, we want the way, and there's something for a future so bright.
Because our bodies, and the future we hold it. We want for you to see that everybody can win. Could it be education or contraception? Girls and boys, we always be fine.
We are family and we are planning to go around the world telling everyone that we demand a voice. We are family and we are planning to go around the world telling everyone that we demand a choice.
We gon' climb up and then rise up. Won't keep our eyes shut, we ain't got enough. I know you tired of seeing things the same way, but in time you realize that things change. We the demographic dividend. You see the work that we putting in. I'ma stay true to me and use my opportunity to show you how to build a community with unity.
உன் வாழ்வு உந்தன் கையில், எதிர்காலம் உன் கண் முன்னில். மனதையும் உடலையும் பாதுகாப்பாய். வேண்டும் வேண்டாம் என்று சொல்ல உனக்கு மட்டும் உரிமை உண்டு. தேவையில்லா குழப்பம் நீக்க வெவ்வேறு பல வழிகளும் உண்டு. உதவக்கரங்கள் உண்டு, முன் வந்து சொல்வாய் இன்று. உதவக்கரங்கள் உண்டு, நீ முன் வந்து சொல்வாய் இன்று. இன்றே முடிவு செய், உடல் நலத்தை உயர்த்தி வை. இன்றே முடிவு செய், உடல் நலத்தை நீயும் உயர்த்தி வை.
Because our bodies, and the future we hold. We want for you to see that everybody can win. Could it be education or contraception? Girls and boys will always be fine. We are family and we are planning to go around the world telling everyone that we demand a voice. We are family and we are planning to go around the world telling everyone that we demand a choice. We are family and we are planning to go around the world telling everyone that we demand a voice. We are family.
Well, welcome today, everyone, to today's session on faith actors and family planning during COVID-19. We're so glad you're here. My name is Mona Bormet, and I'm the Program Director at Christian Connections for International Health. And I'm co-chair of the ICFP Faith Subcommittee, in addition to Peter Munene of the Faith to Action Network and Vic Chua of Catholics for Reproductive Health. On behalf of the Faith Subcommittee, we thank you for joining us today. During today's session, please join the conversation on social media using the hashtags ICFPFaith and Not Without FP. We'll put those hashtags in the chat box so you could be using them. And we're going to start today by sharing a short video that features a few voices of the faith actors that weren't able to join us live today. They include a community health worker from India, a bishop of the Pefa Church from Kenya, a sheikh from Kenya, and a canon from the Anglican Church in Uganda. So please enjoy this short video, and then we'll get started with the panel. Thank you.
मैं आपको बताना चाहती हूँ कि कोविड-19 लॉकडाउन के दौरान हमारे समुदाय में परिवार के संग काम करना बहुत ही मुश्किल का काम था, लेकिन हमारे साथ धर्म गुरु उनके साथ मिल करके हमने जो है परिवार तक पहुँचे और उनको सुविधा दे सके। और परिवार नियोजन की जो सुविधा थी वो भी हम धर्म गुरु के साथ मिल करके परिवार तक पहुँचे हैं और परिवार नियोजन की सुविधा भी हम दे सके हैं। हम आपसे गुजारिश करते हैं, यदि आप ऐसे और अन्य संस्थाएं हमारी इसी तरह से सहयोग करती रही तो हम आगे भी परिवार को सुविधा दे सकते हैं।
COVID-19 pandemic is causing a great disaster to health care system and the world. Kenya has not been spared either. The supply of essential reproductive health commodities has been affected. Some could not be able to access due to the limited movement. As a church leader, we are therefore calling upon the government and the development partners to ensure that these essential commodities and saving commodities are available at all levels of healthcare delivery.
During this time, when humanity is facing the coronavirus pandemic, it is very important that the religious leaders advise and educate the community on the importance of ensuring that mothers, especially the mothers who are expectant, are well taken care of and they are protected from contracting the disease.
Faith communities are concerned about enhancing life. And we know that the challenges related to prenatal and antenatal care are so severe on the babies and also the mother. And so our interest here is to ensure that we take care of the well-being of the mother, especially through things like child spacing.
Thank you again for joining today's session on faith actors and family planning during COVID-19. Lives and day-to-day work and relationships have clearly changed due to COVID-19. And today, faith actors will share how they are addressing family planning during COVID in health facilities, in communities, with the media, and in a variety of countries. So thank you for joining us to learn what tools faith actors have used, how they've adapted, and to share your learnings too. So please use the Q&A box at the bottom of the Zoom screen to enter any questions that you may have. We will be answering all questions at the end of the session. So our first speaker today is Tamara Tudnevic-Gorman, who will focus on the impact of COVID on violence against children and the effect of teenage pregnancies. Tamara is a senior policy advisor for ending violence against children for World Vision International. She has over 20 years of experience in childcare and protection system reform, as well as in policy and program development to address violence against children. Prior to joining World Vision, Tamara worked with a number of international organizations on strengthening policies for the realization of women's and children's rights, including Oxfam, UNICEF, and the World Bank. Welcome, Tamara. We look forward to hearing from you.
Thank you, Mona. Thank you very much. as Mona said, I will speak about the impact of violence on violence against children of COVID-19. We can move to the first slide, please. Even before, second slide, sorry. Even before the pandemic, more than 1 billion children lived daily in exposure to different forms of violence. Violence against girls and boys takes many forms, including physical and sexual violence, female genital mutilation, and child marriage. And we know that girls are much more vulnerable to violence, which can have long life consequences on their mental and other health problems. We also know that in times of crisis, harmful gender norms, sexual and other forms of violence often increase. And COVID-19, unfortunately, was not an exception. Within the weeks of declaration of pandemics and introductions of measures to contain it, we have witnessed an increase in violence against girls and boys in online, at home, and in communities. Because of the movement restrictions and closure of public spaces and schools, the children found themselves in homes which were not safe for them to begin with, or have become unsafe due to the stress of the pandemics. Also, combined with the economic crisis that have reached many communities, these children found themselves almost in a perfect storm. The economic hardships we cannot undermine. I have to say that within the months of the pandemics, World Vision surveyed many communities, and we found out that already more than 69% of people were earning less income than they did before COVID. So poverty is a real concern for us, because hardships related to poverty often are pushing families to resort to negative coping mechanisms, which include sexual exploitation and often child marriage. During the same period in March 2020, thank you for the next slide, we have estimated that as many as 85 million more girls and boys may suffer from interpersonal violence as a result of just 3 months of lockdown measures. And this would be about 30% of increase in incidence of violence. Well, these predictions are unfortunately proving to be true. And as we look at more and more data from the field where we work, we see that these predictions are more or less in the same range. Recently, for example, we speak to children across the globe, and 81% of surveyed children said that they have experienced or seen increased forms of violence in the past months. I just want to tell you that just few weeks ago, I read an article on BBC that noted a 27% increase in cases of child abuse in the UK. So this is not just a problem that is happening in poor countries. And if we know that this is happening in the developed world, we can only imagine how does this look like in places when violence is already a norm and which are struggling with the conflict and insecurity. Next slide. As pandemic continues, we see more and more families that are facing very difficult choices as they battle income insecurity and food insecurity. And I think it's not a secret that marriage of adolescent girls can be perceived by parents or caregivers as a way to reduce the household burden or as a mean to increase in income. You see some statistics here that UNFPA has predicted that 13 more million girls will be married by 2030. And we predicted that 4 million of them are at risk in the next 2 years. This all is already happening. As I said, our colleagues in the field are observing a significant increase in cases of child marriage that are brought to their attention. In some communities, we've seen that numbers almost doubled since pre-COVID period. But poverty also causes another harmful coping mechanism, which is sexual exploitation of adolescent girls, when transactional sex becomes a mean of economic survival. Like child marriage, sexual violence often results in adolescent pregnancy, which is a major concern when it comes to sexual and reproductive health of girls, women, and health of their children. However, adolescent pregnancy also increases due to other causes, and we've seen in this crisis, particularly due to closure of schools. Next slide. We've known from the Ebola crisis that closures during the outbreak have led to increase in teenage pregnancies. And we have predicted that because of the COVID, in sub-Saharan Africa, we will see as many as 65% more girls get pregnant as teenagers. When girls are out of school, their parents may more easily resort to marry them, or girls themselves are maybe spending more time with boys and men than they normally would, which leads to greater likelihood of engagement in risky sexual behaviors and increased risk of sexual violence and exploitation. And this is all not surprising, as many children and adolescents are lacking access to reproductive health education, have little understanding of relationships or of family planning. Next slides. And while the risks of violence have dramatically increased, the access to services and protection mechanisms have reduced. Many women and girls already had insufficient access to sexual and reproductive health, education, and other services before COVID-19. It's the same situation with child protection systems, where in many countries, they were unable to protect children from violence or to stop and prevent child marriage. With the outbreak of COVID-19, they were further stretched or even completely interrupted. The avenues for girls and boys to seek help have significantly decreased, especially in places of fragility and conflicts, in places where gender and social norms were already prevalent, and particularly where stigma of pregnancy out of wedlock was very strong. But in the wake of this disruption of formal and informal mechanisms, new context has also sparked new ways of doing things, and a plethora of localized innovation surfaced. These include scaling up education and information sharing campaigns to support parents, develop technical solutions to give girls and boys options to report violence, and finding ways to support those at risk through training of first responders, which included faith leaders. World Vision is currently equipped over 94,000 faith leaders, and many of which are active in identifying the most vulnerable children, strengthening referral mechanisms to services, and challenging underlying beliefs and values that lead to violence and child marriage. They are also joining efforts to shed light on this plight of girls and boys. For example, 600 faith leaders from West and South Africa have stepped up jointly, calling to governments and their faith communities to accelerate action and provide necessary health and protection services, as well as to condone publicly all forms of violence. In other communities, we have continued to work with faith leaders for our Channels of Hope for Gender and Child Protection programs, which encourages and mobilizes faith communities to promote positive attitudes and behaviors, change gender equality, and gender-based violence such as child marriage. Can we go to the next slide, please? To conclude, we are at the brink of the new era in humanity, facing a crisis that has exposed all the weaknesses in our world: gender inequality, racism, and violence against children. But every crisis creates an opportunity. And this is why, more than ever, we need faith leaders to engage and contribute to efforts to prevent and address child marriage, sexual and other forms of violence against children. And we need also governments and other stakeholders to create their role, recognize their role, and create space for their action. Faith leaders have unique access and opportunity to identify and support vulnerable children that are facing violence. They are an essential resource for healing and resilience. But more importantly, we need them to become a beacon on light that will make invisible suffering visible, and by unveiling and confronting violence against children, help us to finally end it. Thank you very much. Thank you, Mona.
Thank you, Tamara, for sharing the challenges facing children and the importance of caring for children of all ages during this pandemic. I want to say welcome to those who have joined. Please remember to insert any questions in the Q&A box at the bottom of the Zoom screen. And I'd love to welcome our next speaker, Sheikh Saliou Mbake, who is a family planning champion in his country, Senegal. He is president of CRSD, which is the Religious Association for Health and Development, a Senegalese interfaith organization that brings together all religious families, Islamic associations, as well as the Catholic and Lutheran churches in Senegal. He has served as the Continental Coordinator for Interfaith Action for Peace in Africa an advisor to the World Face Development Dialogue for a family health project in Senegal, and a program coordinator in West Africa on faith and development for the Population Reference Bureau. The Sheikh is a spiritual leader of the Muriti family, a core institution of Senegalese Sufi Islam. He has lived within that tradition since birth. Welcome, Sheikh. Please, we welcome you to turn on your camera and share with us today. Thank you.
Thank you very much, Mona. Good morning, good afternoon, good evening, everybody. My name is Sheikh Saliou Mbacké. I am the president of CRSD, and I'm going to talk about the work we've done through the media to bring about interreligious cooperation in the fight against the pandemic of COVID-19 and its negative impact on the programs of family planning. Next slide, please. Next slide, please. So since the outbreak of the COVID-19, CRSD, our organization, pivoted some of its program activities to the fight against the pandemic and its negative impact on family planning services, like I said before. Thus we put in place a program which we have been implemented through the media, through the various media that are here in Senegal, i.e. television, radio, and digital and social media. And the choice to use the media is just very simple, that nowadays you cannot do a good job without passing through the media, because they are a link to the communities in the various places wherever people are, especially here in Senegal. Community radios are widely used to communicate programs, but we also used digital media and social media to reach out to various groups, including the youth, including young people. Next slide, please. I wanted to also highlight that we have been using in our strategy the expertise of some of our members, because amongst the CRSD members, there are some who have expertise in communication, but we've been working with also a communication expert to carry out our program. Here are some key factors, as you can see, since the beginning of the pandemic in March, between March and September 2020, a number of programs have been produced and broadcasted through various media, as you can see with the numbers you have on the screen, which just denote the number of people we've been able to reach through these programs. Next slide, please. In the second period of the pandemic, September to up to right now, we also produced or conducted training workshops for religious leaders and health workers and community liaisons in the regions of Senegal and Saint Louis. Whilst the first program was actually nationwide, covering the 14 regions of Senegal, this second wave of programs has been specifically focused on 2 key regions, with also a focus on training healthcare providers to equip them with the necessary tools, religious argumentation, so that they can also defend the relationship between COVID-19 and family planning. The same way we did with these community liaisons called Bajenu Gox, which you will see some pictures in the next slide, please. So these are on the left, on my right-hand side, these community women leaders we call Bajanugor. These are very important women who are quite influential in the community. They do a door-to-door program work, sensitizing women on family planning services, or also trying to convince them to attend health facilities, because one of the problems that has resulted from COVID-19 is the lack of attendance of women in need of family planning services to attend health facilities for fear of contracting the disease in the health facilities. So our work has been to train these community women leaders to go and sensitize women to attend these health facilities so that it does not impact negatively on their family planning needs. On the left-hand side, you have also some of these women, health workers, health care providers, and Bajanugors being trained on our campaign on sensitization of communities, especially women in family planning needs, to go and attend health facilities. Next slide, please. And here we're going to show a short video of a woman. This woman is a midwife. She's a midwife who heads a clinic in one of the communities, in one of the neighborhoods in Dakar. But what characterizes this woman is that she also carries a religious hat, apart from her professional skills like technical skills. So she's the one who accompanies CRSD in our advocacy work, in our sensitization work, where when the religious leader does the religious argumentation, then she does the technical health argumentation of our advocacy. So let's listen to this woman.
asalaamaaleykum mbokk yi maa ngi leen di nuyu di leen ziar tey nag man maa ñëw di wax ak yéen man en tant que sage-femme, en tant que jigéen ñëw di wax ak sama mbokku jigéen yi di leen wax ne jàngoro ji am na mi ngi fi te ñun dañ ko war a moytu en tant que jigéen ndax ñun jigéen ñi ñun ñooy yaay ñooy ndey ñooy bàjjen ñooy lépp kon nag ñun suñu ko moytoo rek ñëpp moytu ko rawatina nag jigéenu wérur yi dañ ko war a moytu li tax nag jigéenu wérur yi war koo moytu.
Okay, this small video shows then this woman, Mrs. Rokhaya Cham, urging women to, in our language, in the Wolof native language of Senegal, to attend health facilities. Women with family planning needs to go and attend health facilities and not to be scared of COVID-19. So some key factors in our engagement in numbers you can see here, but overall I think we can say that using the media has been instrumental in advancing in our work and communicating our work as religious leaders in terms of sensitization and of communities to take the mitigation barriers, and also urging women in family planning needs to go and attend health facilities. I think we can move on to the next slide. Here are some pictures that on the right-hand side you can see some CRSD members inside radio stations, talking about the topic of COVID-19 and its relation with family planning. And on the left-hand side, religious leaders, CRSD members outside the studios being interviewed by the media. Next slide, please. And to finish with some recommendations and reflections, I think that overall we can say that religious leaders have a very important role to play. But most importantly, I think we need to address in this period, the conspiracy theories about COVID-19, especially prepare our communities for vaccination, and to fight against vaccination hesitancy. Convince people who are reluctant or hesitant to go to be vaccinated. Religious leaders can do that, can play an important role with that. Thank you very much for listening to me, and I look forward to seeing everybody in the next ICF meeting next year. Thank you.
Thank you so much, Sheikh. It's so encouraging to hear how religious leaders have engaged with community education and sensitization on COVID-19 with the media in Senegal, especially in local languages. I'm curious for the rest of those of you who've joined us, welcome. Have others of you have you been engaging religious leaders in media in your countries? If so, please share in the chat box. We want to learn from each other today. And please remember to insert any questions in the Q&A box at the bottom of the Zoom screen. Our third panelist today is Martha Saidi. Martha is a project manager for World Relief Malawi SCOPE project. SCOPE stands for Strengthening Community Outcomes Through Positive Engagement. It is an RMNCH project funded by USAID through the NPI mechanism in Haiti, Kenya, Malawi, and South Sudan. Martha is a trained nurse and a public health practitioner. She has over 15 years of experience working in healthcare and health project management in Malawi. And World Relief is a faith-based nonprofit organization serving the most vulnerable through faith institutions, including local churches in 9 countries. Welcome, Martha. We look forward to your sharing.
Thank you very much, Mona. I'll be sharing with you family planning lessons from Malawi and Burundi, just showcasing the work that World Relief is doing in these 2 countries. Next slide. So as World Relief, we started responding to the COVID-19 pandemic as soon as the pandemic started. We did a lot of learning and shared the lessons with different partners, including the faith community. So far, we have reached over 1 million individuals with COVID-19 programming and over 11 million with mass messaging. At the heart of our work is our collaboration with the faith leaders. We have reached so far 71,800 faith leaders in these 2 countries, 18,755 in Malawi and over 10,000 in Burundi. Next slide. I'll talk about Malawi SCOPE project. Next slide, please. This is a 5-year project funded by USAID, and it aims to increase access to and utilization of maternal, newborn, and child health and family planning services, enhancing quality, improving healthy-seeking behavior, and also strengthening community and facility linkages through different drivers, community healthcare workers as the key players, faith actors, and also community volunteers. Next slide. So far, in COVID-19 response, we've managed to empower faith institutions to disseminate standardized COVID-19 messages. We developed sermon guides and posters and leaflets, which we shared with the faith institutions for them to in turn share with their congregants. We have mainstreamed COVID-19 messaging in routine health services and also in all our meetings with faith community, as well as with the CHWs at all levels, just to ensure that the message is getting across to everyone and also to try and combat stigma around COVID-19. We have supported MOH in the rollout of emergency contraceptives by ensuring that the new CHWs that have been recruited by the ministry have received training in family planning and also in community-based maternal and newborn care. This has been a priority in Malawi, especially with the understanding that we experienced an increase in teenage pregnancies from around 29% to 35% increase in just the period that we had COVID-19. So World Relief responded to this increase by ensuring that the CHWs that are in the community have capacity to complement, to provide services in family planning at community level, just to increase access. We also developed a COVID-19 dashboard internally as World Relief, and alongside with the MOH caseload data that we were receiving on a daily basis, it helped us to tailor-make our programming. Next slide. We did a survey in November just to learn how the faith leaders are faring in integrating COVID-19 messaging. And we learned that they're faring really well, and congregants were able to testify that now their shehers, as well as their pastors, are sharing messages on COVID-19 during church sermons and mosque gatherings. Next slide. What worked best in Malawi? Well, we continued our operations in the community because we experienced that during COVID-19 pandemic, the community healthcare workers were under a lot of pressure. There was a lot of reallocation and refocusing. So as a partner in the community, we had to ensure that our presence was paramount. And we had to do this by ensuring that our officers who are based at community level are still providing services, supporting supervisions and trainings are continuing while following the COVID-19 preventive measures strictly. And also strengthening of the community level health services, it ensured that there was reduced pressure in the hospitals and health centers, which were already constrained with COVID-19 response. Well, in response to COVID-19 as well, we did redesigning of our activities in the first year of the project, just to allow ourselves to be able to implement from a distance. And this also helped us to be able to roll out our activities in the second wave. We developed a module, particularly for the care group volunteers. These are volunteers based at in the community at household level. And this module will be rolled out alongside with every technical training that will be providing to our volunteers, which means COVID-19 messaging will be reaching every household in the communities that we're working with. Next slide. I will now talk about our project in Burundi, impact of church-based outreach on family planning project in Burundi. Next slide. This is a 3-year project funded by John Templeton, and we aim to influence the beliefs and underlying social norms that affect issues around fertility and also adherence to family planning. We intend to also raise awareness and educate about 9,600 couples using the Families for Life model. This model allows training of a few couples as trainer of trainers, and then they in turn train other couples and also train other couples. So just following a cascade model. And it allows the couples to discuss issues around fertility and also share lessons in smaller groupings. We also intend to train and mobilize faith leaders on couples counseling too, and also family planning focused sermons. Next slide. Well, we learned a lot during the COVID-19, well, we still have it. There's been a steep drop on face-to-face Families for Life meetings. There was also a reduction in group contacts, and also church services had reduced significantly. And there was reduction in access to healthcare services, including family planning services. And this was mainly because of fear, anxiety, rumors, and lack of accurate information on COVID-19. And also stigma associated with conflicting messages. As World Relief, we had to re-strategize our approach to couples gatherings by reducing the group size so that we could effectively collaborate and also engage them while adhering to the COVID-19 preventive measures. And we also leveraged previously established relationships that we had with the faith leaders and the CHWs. It created a very effective platform for us to be able to roll out messages on COVID-19, roll out guidelines and tools and all the IC materials. And because of this trusted relationship, it also helped to create a trusted foundation that could also address issues around fear, anxiety, around COVID-19. We had to reallocate some resources just to establish hand washing stations, especially in areas where water is a scarce resource, and also for families which soap is a scarce resource as well, just to ensure that they're able to adhere to COVID-19 prevention, hand washing, and face masking. Next slide. What worked well in Burundi? We learned that leveraging the partnership that we had with couples and also the partnership that we had with church leaders and CHW, it created a pivotal role for us to roll out emergency preparedness plan and communicate risk messaging in remote areas. And despite the pandemic, the program interventions continued because of our presence at the lowest structure. And so we're able to share preventive measures among our staff and our volunteers. and also empowering the faith networks with timely and accurate information on COVID-19. It helped the congregants to adhere to prevention during church sermons. We could see wearing of face masks, washing hands before entering the church or entering the mosque, and also maintaining social distance. We also learned that promoting the government agenda to COVID-19 prevention was also beneficial to ensure that there's uniformity and a collaborative participation in COVID-19 response. Next slide. Thank you very much for listening. Thank you.
Thank you so much, Martha. It's good to learn that religious leaders are sharing COVID-19 messages and sermons, and that community health programs have pivoted, and how you're working with care group volunteers at the household level. Love to hear that. And I love also seeing what others are sharing about their work in the chat box. Please keep sharing so we can learn from each other. That's wonderful. And so far, we've heard a global perspective from Tamara. We've heard about what's happening in Senegal from the Sheikh. We've just heard about Malawi and Burundi from Martha. And now we're going to dig a little bit deeper to a county level perspective from someone from a specific health facility in Kenya. So please remember to insert any questions in the Q&A box at the bottom of the Zoom screen. After our next speaker, we'll start trying to answer some of those questions. So our last panelist is Nicholas Odhiambo from Oyani Seventh-day Adventist Dispensary in Migori County, which is in Western Kenya, where he is a nurse. Migori County borders Homa Bay, Kisii, and Narok counties, in addition to the country of Tanzania and Lake Victoria. Oyani Dispensary is supported by the Faith to Action Network, an organization of African instituted churches, to ensure that family planning is an integral part of maternal, neonatal, and child health, integrated outreach services for poor rural women, including adolescents, focused on information, education, and services. We welcome Nicholas to unmute himself, turn on his camera, and begin his presentation to share about the provision of family planning services during COVID-19 and adapting to changing health-seeking behaviors through home visits and outreach. So Nicholas, please, you're welcome, Karibu, to turn on your camera and start your presentation. Thank you.
Thank you, Mona. The COVID-19 cascade effect on Oyani SD dispensary programming and response. We as Oyani SD dispensary, faith advocacy response to COVID-19, we continue to conduct facility management check-ins on program implementation and adherence to COVID-19 prevention measures and containment. We worked with religious leaders to conduct continuous health education sessions at chiefs' barazas, that is in village assembly, and at religious gatherings while observing COVID-19 prevention measures. We further worked with faith leaders to engage mass media, that is local radio, to propagate family planning and COVID-19 messages in local languages. Faith leaders use scripture to demystify misinterpretations of child spacing. We advocated further for continued support and funding for maternal neonatal child health / family planning services. We supported MOH and community health advocates using the national MOH guidelines on continuity of family planning service at health facilities and community. We adhered further to national guidelines on COVID-19 prevention measures by sensitizing staffs, CHVs, that is community health volunteers, and community members. Next slide. We, as Oyani SD dispensary, we worked with faith leaders using the booked-in clients, phone booking, and scheduling of clients, especially for long-acting reversible contraceptive services at health facility to reduce crowding and maintain social distancing. In collaboration with faith champions, we conducted community dialogues to disseminate MOH COVID-19 guidelines. Faith leaders mobilized community members for sustained facility enriches, outreaches with strict adherence to COVID-19 guidelines, provide integrated reproductive health services to the community. We integrated family planning services at all services delivery points at the health facility to reduce missed opportunities. Self-referrals following sustained demand creation by County Department of Health and religious leaders through radio talk shows, as seen in the picture. Next slide. Through social benefits of continuity of family planning service by Oyani, we reached male partners and provided male counseling, which has led to increased uptake of modern contraceptives. We continued access to family planning service by clients despite COVID-19 pandemic fears and anxiety. Good coordination and cooperation between facility, community, and community health volunteers due to dissemination of accurate information on COVID-19. Next slide. In conclusion, we as Oyani SD Dispensary, the efforts and results of Oyani attributed to the seamless coordination between the national and county governments, district facility, faith community, and communities enhanced facility preparedness to continue providing undisrupted family planning services amidst COVID-19 pandemic to reach women of reproductive age. Next slide. Thank you and welcome.
Thank you so much, Nicholas. Asante sana. And thank you to all of our panelists. We're going to start Q&A in just a minute. So I would just encourage us in the Q&A box, and we'll start Q&A shortly. We are very grateful that the ICFP Forum brings us together to learn, to share, to find innovative ways to improve the quality and coverage of family planning work in order to meet the reproductive health needs of the community. The COVID-19 pandemic has shown us how quickly our approaches and our systems can be impacted and may lead to negative results or creative solutions. And faith communities and faith leaders play crucial gatekeeping and influencing roles in the success of advancing health in developing countries. Our recommendations as a faith subcommittee are to leverage faith communities. And these recommendations include that we ask national governments, global health actors, and humanitarian organizations to discuss with faith leaders how values, beliefs, and practices support or conflict with family planning, and especially during COVID-19 for vaccine planning processes and messaging development. We also encourage collaboration with each other to ensure faith communities have the most accurate evidence-based information, and so they can commit to sharing that information. This really ensures in dispelling myths and rumors. And we also recommend investment in research and interventions to help the sectors understand, leverage, and more effectively partner with faith leaders and communities to promote life-saving behavior change. This could include a barrier analysis survey on key barriers and determinants driving actions and decision-making. We also believe any advocacy and policy making should include a wide range of stakeholders, including faith actors. And more recommendations and information can be found on the ICFP website and the website of CCIH and many of our speakers. I love how many people are sharing different tools and different information. And right now I'd love to move to Q&A. So I'm going to ask of all of our speakers if they could turn on their videos if their bandwidth allows, and I will start asking some questions that have come in. So if Tamara and Sheikh and Nicholas and Martha, if you could turn on your videos. The first question is actually for the Sheikh. So the question comes from Rita. I am curious, how did you select the leaders you chose to sensitize? Did you prioritize working with those already close to supporting family planning? Or did you look at those who voiced strong opposition and sensitize those? So Sheikh, open to you. Please unmute. Sheikh.
Okay, so
Great, thanks.
Thank you very much, Mona. I think I skipped that question. Actually I answered all of them, but maybe that what I. Yes. Anyway, in our work in CRSD, since the beginning, CRSD is composed of prominent religious leaders who are very influential. Okay, but these people had to be trained on family planning because we didn't know much about family planning. Family planning is not part of our daily work before we engaged in this work. Okay, so some training was needed, you know, of these religious leaders who are actually open-minded religious leaders, but still family planning being something new, you know, and somehow controversial, you know, because some do agree about it, but others don't agree about it, especially on religious grounds. So we needed to actually train everybody about that, you know, using religious argumentation, because that's the only way, that's where we can base our argumentation, by extracting religious messages, you know, religious scriptures, you know. So after training the members of the group, now we could go out and give out the messages, you know, throughout the media, through workshops, etc., etc. Obviously, as you have rightly said, there are some detractors, those who are against family planning. Those are also a target, you know. We wanted to convert those, you know, so that they accept family planning by giving a solid religious argumentation about that. So we did so through, you know, producing an argumentation and all that. So it is actually both. So the target is religious leaders who are open-minded, who are open to family planning, but also those who are not necessarily open to it. So, but still, we needed to convince everybody by using religious argumentation. Okay, so together with the health facilitator, the health expert, we could explain both aspects, religious and health. Does that answer the question?
Yes, so. Thank you, Sheikh. The next question I have is for Martha. Martha, I hope you're still there. If you're able to unmute and turn on your video, that would be great. I'm going to try to combine two questions into one, Martha. So someone has asked if World Relief works with faith-based facilities to increase access to family planning services during COVID. And the other question is, did you provide any protection for religious leaders, especially for the couples counseling group sessions? So if you might be willing to address those questions, that would be great. Thanks, Martha.
Thank you very much. So to respond to the first question, yes, World Relief engages faith institutions. We also, in Malawi, we collaborate with CHAM. CHAM is a Christian Health Association of Malawi, and they implement health services. They have hospitals and well-established facilities, and they ensure that they are providing training to their healthcare workers in family planning. And we also work with the faith-based leaders. We conduct meetings with them, and we provide training to them to ensure that they understand their responsibility to respond to issues happening in their communities, including issues around family planning. So we give an equal opportunity to all the faith institutions to participate in our program in the catchment area that we are focusing on at that particular time. And to respond to the second question, yes, we are providing preventive resources to support prevention of COVID-19 to the couples groups. We provide face masks. We provide, I mentioned in my presentation, hand washing facilities, and also soap to the families that are resource constrained, that do not have soap readily available. So we ensure that these are being followed, and we provide resources where necessary. Thank you.
Thank you, Martha. I appreciate it. The next question I'm going to ask is for Nicholas. Nicholas, are you still there? Are you able to turn your camera back on and unmute yourself? I know it is late. Are you still there? I know Nicholas has a
Yes,
helper.
I'm still there.
Oh, great. Could you turn your camera on, Nicholas, if it still works?
Yeah, of course.
Okay.
There were a lot of challenges that we as health workers we faced in providing lab services, especially to the community. We had not enough PPEs with us, and we were really not able to give out the services. We were totally afraid. And later on, due to dissemination of the COVID-19, we later on were provided with equipments, with PPEs, and we disseminated everything to the community, also to us, and we continued well. Thank you.
That's good to know, Nicholas. Can I ask, there was a question, if there was a fear among clients or women in your community about contracting COVID if they were to come to the facility. Was that a fear? And if it was, how did you address that?
Yeah, there was a lot of fear to the women in the community because they did not want to come to the facility due to the COVID-19 that they were going to contract from us. Also, they were not even coming out from the villages. But due to dissemination of the COVID-19 at the community, through church leaders, us too, through radio talks, it was done well. They later on started coming to the facility. Yes. Thank you.
Okay, Nicholas, thank you. There's a question about LARC, about long-acting reversible contraceptives. Did providers at Oyani, did you face any challenges providing LARC? Do you provide LARC methods at the dispensary, or do you have to refer people to other facilities?
We provide in our facilities. When we had disseminated everything, mothers do come to the facility and we provide long-acting reversible contraceptives, observing COVID-19 measures very well.
Glad. Thank you, Nicholas. Yeah. Great.
Thank you too.
Okay. Yeah. Let's see. We have more questions. I'll go to someone else now to give Nicholas a break.
Thank you.
There is a question. Let's see. Sheikh Saliu, can I ask you to unmute and turn your camera on again? It looks like Sheikh Lathom has said, in Kenya, Muslim religious leaders accept child spacing, not family planning. Do you have the same problem in Senegal?
Say that again.
One of the religious leaders says, in Kenya, Muslim religious leaders accept the term child spacing, not family planning. Do you have the same problem in Senegal? Like, what terms are acceptable in Senegal?
Yeah, it's right. Well, here we rather use the term birth spacing. Birth spacing but we add amongst married couples. Sometimes we even add among legally married couples, just to put you the whole picture. The word family planning, in fact, has a sort of a negative connotation somehow in the mindset of people, and it has been like that since I don't know why. The word planning has had such an unpopular, reaction from the people. So I don't know. Even the translation into French of planification familiale is better accepted than the word planning, with the English word planning. And I just cannot tell you why, So actually, we've tried as much as possible to avoid the term family planning, although it is the overall subject. But we say we use the phrase family planning understood as birth spacing amongst legally married couples. It's a bit too long, but just to get that acceptance, because it is very important to use language that people accept to get your message across, rather than use language that will be rejected in the first place and not given even a chance, to give your message. So this is one of the strategies, really trying to avoid any language that is controversial or rejected, or where people do not feel comfortable, and use language that people feel more comfortable with. Thank you.
Great, thank you, Sheikh. I actually think there is a question here that could be applied to most of the panelists. So if all of the panelists are willing to turn their camera on, I'm going to try to reword it a little bit. There's a question in here about, do you know if faith leaders have any personal biases or prejudice towards contraception access by adolescents? And how do you work around that? Because we know that some adolescents are married, some are not. Sheikh, you just mentioned sometimes the term is marriage. So what do you do when issues for adolescents come up? So Sheikh, if you're willing to start, and then maybe Martha, if you could talk about your experiences, and Nicholas and Tamara, that would be great. So Sheikh, Martha, Nicholas, Tamara. Go ahead, please.
Yes, I think the subject of unmarried youth and family planning is a very challenging one for religious leaders, and it has been like that over the last decades, I would say, and it's recurring every day. But our strategy here has been that our focus is on married couples. Okay, the issue of youth, unmarried youth, has to be dealt with in a different manner. Okay, in a different manner means it has to be tackled from another perspective, because the problem again is still here in our societies is the word, the language you use, because the word carry a certain weight. If the word sex or sexual can be actually can sound quite negative in our communities, So it is always preferable to go around and use language that is more appropriate to get your messages across. So we focused here, for example, the issue of comprehensive sexual education. We've turned the wording into something called education to family life, for example, to suit acceptability, to use terms that can actually suit the susceptibility of people, and that word that can be accepted. But we are working on that, on the subject matter of the youth, adolescent pregnancies, adolescents reproductive health, because it is happening, whether you want it or not, it is happening. And sometimes it's even a drama because it's not addressed, or it is taboo about it and all that. But there's a way for religious leaders to go about it. Religious leaders cannot talk about sex out of marriage, because we will be out of our own context, religious teachings. But being a social reality, religious leaders have a role to play in addressing these issues. But it is a matter of letting religious leaders also to define the strategy of tackling this issue, talking about it, because if we are told to follow or to apply programs or language that does not suit the susceptibility, or that would affect the susceptibility of people, it will be a very counterproductive strategy.
Well, very wise, Sheikh, very wise. The importance of the cultural situation, the community, the different faith communities. So thank you for sharing that. Martha, any perspectives from you?
Yes, actually. So, well, there are a lot of harmful practices that are being practiced out there. We are aware of that. And I think as an organization, we have taken that to be something that needs to be addressed for us to be able to accelerate efforts to improve family planning access and utilization. We have a module that addresses issues around sexuality that we provide to adolescents and the youth in general. And we also have additional modules that target the faith leaders just to ignite discussions around sexuality for the adolescent and also to build their capacity on how they can engage an adolescent or a youth to discuss issues around family planning. So in our programming, we just make sure that everyone gets the message regarding family planning and understands their responsibility in relation to family planning. And we leave the decision to access a method or not as being voluntary. So this is what we are capitalizing on during our programming. Thank you.
Thank you, Martha. It's good to hear that there's a specific part of curriculum that is geared towards that population. Nicholas, if you're still with us, are you able to unmute and show yourself? We would love to know at the community level at Oyari Dispensary, how do you handle and work with adolescents who come for family planning services? Are you still there? Let's see. No? Okay, maybe while Nicholas is trying, Tamara, from your perspective, I know you were talking about the global perspective, but is there anything you'd like to add on how World Vision addresses adolescence and family planning? Thank you.
Mona, hi. I would just say that I am not a faith leader. And when we work with faith leaders, we try to come to the perspective with them, what is the most culturally appropriate way to address this issue. A lot of the work that we do is to expose the roots of causes of the teenage pregnancies, to remove some of the myths that exist around, to decrease stigma. And religious leaders help us a lot with that. But when it comes of how is this going to be implemented in a particular community, then we really work with different denominations and different faiths to understand what's the right way. So I won't spend much more of your time. I think our esteemed religious leaders who were every day deal with these issues, and they can share how they are resolving this important issue.
Okay. Thanks, Tamara. Someone just made a point that he didn't know what you mean by you're not a faith leader. So
I'm not an ordained faith leader.
Okay, but you're still a person of faith, so that's okay.
Absolutely.
Yeah, thank you all. So a few more questions that I'm trying to get to, but thank you all. We have a question here that is about how we as faith leaders innovate to address family planning in COVID, especially promoting male engagement. So I think the question is about how have you all, maybe male engagement is brought up for a reason. I think Mohammed from Ghana has brought up this question. Martha, I don't know if there's anything specific you want to share about how you've engaged males more than females. I'm not sure.
Thank you. So, well, most of the faith leaders that we're working with are male. And in our meetings, we encourage the faith institutions to also send female participants. So they're largely male. But then when we go community level in our couples meetings, that's where we manage to strike a balance. So we make sure that in our couples meetings, people are coming with their spouses so that we have a 50-50 representation. And like I mentioned already, in our community meetings, we encourage women participation because mostly we have men participating in those meetings. So yes, that's how we basically rolling. That's what I can share. Otherwise, we are not experiencing reduction in male participation. Thank you.
Okay, thanks, Martha. Does anyone else want to talk about male participation in their programming or in their outreach? No. And I will also say that one of Nicholas's colleagues answered the question about how they work with adolescents at their dispensary. So thank you for answering that in the chat box. That was great. Okay, there is a question for Sheikh Mabake about when it comes to areas that I think you said are out of your religious context, as you put it, are there teachings in compassion or non-judgment that you can turn to help address difficult topics such as adolescent contraception?
Yeah, I was just typing the response, but anyway. Yes, sure. I think that compassion being a virtue, a religious value that is, applicable to all mankind, regardless of marital status or whatever. A religious leader has to be, has to, give positive messages about that. Anything that it is life-threatening or any drama that actually affects the human being. But the religious teachings also, religious also has norms that the norms cannot be, overrun or, so religious teaching, religion has norms. So we can also ask religious leaders to endorse behaviors that go outside its norms. But obviously, anything that is life-saving, because sacredness of life is also a value in all religions. So life is sacred. Anything that can save life, is accepted by religion. But we cannot encourage behaviors as religious leaders, behaviors that go outside religious norms, because again we would be contradicting the religious teachings. But yes, we are taught to be compassionate to any person who is suffering from any trauma. But religion also urges people to be responsible and to live responsibly. Those are the teachings that we cannot go out of in respect of religious norms. But yes, compassion is there, for anybody suffering.
Yeah. Thank you, Sheikh. I think kind of a follow-on question, not just for you, but for others, is there's a question about youth participation and dialoguing with religious leaders. And I'd like to expand that a little bit. What we've noticed is we're encouraged to engage youth in discussions. We're encouraged to engage younger religious leaders, but there's often hierarchy in the church coming from a Christian perspective, or there's hierarchy in different religious structures. And so sometimes young religious leaders have to follow that hierarchy also. And so I would just be curious if Martha, in some of your programs, if you've been very specific in trying to engage people of different ages. And then maybe Nicholas, I don't know if at your dispensary, like on your advisory committees for your dispensary, if there's youth that participate in those committees. I would just love to know, maybe from the two of you, if you're able to answer that question. Martha, would you like to go first? If you're still there. Yes, great, thank you.
Yes, thank you very much. So indeed, I would like to agree with you that it's really important. There's an outcry out there from the youth that they need to be engaged in these issues. So as a program, World Relief, we made a deliberate effort to start responding to these issues right away from recruitment. So when we are recruiting our volunteers on the ground, we also include youth volunteers. For instance, in family planning program, we have youth volunteers that are also being targeted to provide services. And so it will be easier for them to relate to the youth. And also collaboration between the volunteers, the CHWs, and the faith community. So the volunteers are able to also relate to the youth structures within the church. Most of the churches have youth groups. So the youth volunteer who is responsible for providing the service and educating on family planning is able to collaborate with the youth structure within the church to provide information and also services. So this is how we are responding to the need to address the youth on family planning. Thank you.
That's encouraging, Martha. Thank you so much. And Nicholas, I see that you're trying to write an answer in the chat box. But if you're able to unmute and share, that would be great too.
Yeah,
Nicholas,
it's true.
Great.
It's true. I'm getting you now. In
Yes,
Oyani,
please.
in Oyani, we work with adolescents in groups. That is the Young Moms Club. They get information on family planning issues. And we also, there is a youth representative at the facility committee that we talk to. And we follow also the CHVs, community health volunteers, that talks with them in the community. So they come and we schedule them as per the dates that we give them, and we give them the family planning methods.
Great. Thank you so much, Nicholas. Thank you.
Yeah.
Sheikh, it looks like you'd like to say something. Please unmute. Are you there? Sheikh Mbake? Ooh, I wonder if we lost him. Well, I know we're getting close to the end of time. So I'd like to, I know we didn't get to all the questions. I'm really sorry. We had questions coming in individually and in the Q&A box, but I'd like to give each of the speakers just a minute to share anything else that maybe has come to mind about the role of the faith community or religious leaders in family planning, especially during COVID. Is there anything else you'd like to share? So I'd like to start with, oh, it looks like the Sheikh has come off. Are you there?
Yes.
Okay,
yeah,
go ahead. I'll start with you.
I just wanted to add a bit on the youth, a dialogue with the youth. Is that okay?
Yes, please.
Yeah? Okay. In CRSD, we started a dialogue program with the youth in the Sahel region, in the Sahel, okay? That's with our partner PRB. You know, we produce an engaged multimedia tool that, you know, talks of dialogue between religious leaders and the youth on family planning, education to family life, FGM, and child marriage, okay? We think that this dialogue is extremely important, okay? Because the platform has enabled religious leaders and youth to interact in a very frank way. Religious leaders will listen to the youth, talk frankly about their problems, and religious leaders would also reply, giving their positions, you know, and we would go back to text, religious texts. We used data with PRB, you know, and we used various sources of information really to come up with something that has, you know, enabled the youth and religious leaders to talk about these 4 areas, you know, in a very open manner. And we think that we are in the process of disseminating it now in the 4 countries that are involved there. So it is possible. It is possible, really. Sorry. Yeah, it is possible it's possible and recommended to establish this dialogue, but it has to be also, it's a process. It's something that the two groups, youth and race leaders, should work together to develop. It's not something you bring in, it is a conversation that will at the end yield into something that is a consensus about the topics, and that can, something you can give out, and we are doing it. We are disseminating it to the communities, and it is being received and welcomed.
Great. And I see that someone from PRB put the link in there, so that's great. Because of time, I'm going to move on and see, Tamara, if you're there, any closing remarks, anything else you'd like to share?
Can you hear me?
Yes.
You hear me? You hear me? Yes, I just want to say that I am humbled to see all these efforts religious communities and leaders are doing to both address the reproductive health issues, but also to address violence against children. And I'm very grateful that we had this opportunity to meet and to hear from the first hand how to overcome some of the challenges that are real and that we often struggle with. So thank you very much to all the speakers and to you for organizing.
Yes, thank you, Tamara, for your participation and your sharing. Martha, anything that you'd like to share with the group?
Yes, thank you, Mona. I just want to share that it's very encouraging for us as partners, and the trust that we see and experience from the faith leaders. And so we need to leverage this opportunity to ensure that there's a continued collaboration between the technocrats and the faith leaders, and also ensure that the faith leaders have accurate information. So we need to have purposely developed curricula that integrates their faith with real technical issues on the ground, so that they should be able to relate these two things. So we need to ensure that we are leveraging this opportunity moving forward. The faith community has a very big potential to assist in improving healthy outcomes. This is what I wanted to share with you. Thank you.
Thank you, Martha. Great to hear about the work in Malawi and Burundi. Thank you. Nicholas, is there anything else you'd like to share before we close? I don't know if you're able to unmute, Nicholas.
Yeah, it's true. Religious leaders are very influential, and their followers do understand them very much. So they do understand everything that they are being told about COVID-19, and they come to the facility due to that understanding, and we give them the family planning updates as per each that they require. Yeah, they're very influential too. Yeah.
Good to hear that, Nicholas. I'm so glad that you've been able to join us from the dispensary in a rural area, that the internet worked. How great for us all.
Thank you.
And I just like to close by thanking everyone for joining us for the session to learn and to share and find innovative ways to improve the quality and the coverage of our family planning work as communities of faith and partners. I've loved what everyone's been sharing in the chat box. I really hope that you enjoy the rest of the conference. And in 10 minutes, if you could join us on Facebook Live for the Real Talk, Real Stories, and Real Family Planning session. Kathy put the link in the chat box. Clementina from the Cameroon Baptist Convention Health Services will be one of the speakers. So we're also excited to hear what she's sharing about her work in Cameroon with the faith-based organization there. So thank you so much. Have a great rest of the day. Enjoy the conference, and just blessings to everyone on all of your great family planning work. Many thanks, everyone.
power to be seen across the world. We're not the future, we're the present. Invest in us and you will see the world is changing.
Because our bodies and the future we hold it. We want for you to see that everybody can win. Could it be education or contraception? Everyone will always be here to sing.
We are family and we are planning to go around the world, telling everyone that we demand a voice. We are family and we are planning to go around the world, telling everyone that we demand a choice. We on the ground in every area. We're the ones to make a world a better place.